All right, it is House Calls with MedStar Health, and we're talking about lung cancer and lung cancer treatment. Dr. Chen, medical oncologist, joining us now. You know, lung cancer, not the death sentence maybe that it used to be. Talk to us about some of the clinical trials.
Yeah, so clinical trials are very, very important. They're a way for us to find new treatments that help us do better than what we're doing now. So they're a way of testing new treatments to see if they're both safe and effective. And if they're successful, then they can become the new benchmark, the new standard of care of how we treat future generations until the next breakthrough comes along.
A lot of people reluctant. Are clinical trials safe?
That's a common question. You know, patients worry that, am I going to be a guinea pig? And you know, what trials our priority is safety. And so there's independent committees that ensure that the patient's safety is put at the forefront. And informed consent is very important. Patients have to consent to everything that goes with the trial, and it's purely optional. And at any time, they can withdraw consent and leave a trial. Nothing's ever set in stone. You have to see this to the end. You know, patients are fully in the driver's seat.
You're looking at the patients now participating in the trials for the coronavirus vaccine.
That's right.
And eventually saving lives, hopefully. You were looking at our experts next door in the other studio. The number to call is 410-671-0702. So is that an option, participating in a clinical trial, doctor, for somebody who has lung cancer?
There are many, many, many trials for lung cancer right now. And for all the different stages of lung cancer, for all the different types of lung cancer, there are specific trials designed for each type of lung cancer. And that's how we make these breakthroughs. And that's how we've made so much inroads in getting closer and closer to maybe one day curing lung cancer. So yes, the answer is yes, there are many, many trials.
Now, is everyone eligible? How do you find out if you're eligible for a trial?
So every trial has its own inclusion and exclusion criteria. You know, trials want people with certain types of lung cancer, certain stages, and then they want patients that meet certain criteria. So patients that have to have certain level of health, they have to have good blood tests, and they have to have not many other medical problems. So it's up to the doctor to look through those criteria and make sure a patient is eligible, and if they are, then we will discuss it in detail and see if they consent to go on that trial.
Dr. Chen, thank you so much for joining us, and we want you to know that we're going to have this full interview up on our YouTube channel. In about 30 minutes, we're going to continue our discussion with the Chief of Thoracic Surgery at MedStar Health's Angelo Center for Lung Diseases, but I'm going to send it over to Patrick.